Good afternoon, everyone. This is Sarah Arakinas, your clinical pharmacist. So, new hypertension guidelines finally were published in a month ago, 2025. I've included the link over here also in this video, and I just want to go over the summary of information provided, especially the changes in this video, and two other subsequent videos that I will be publishing for you to know what are the changes for this new exciting hypertension guidelines just published. So one of the changes in adults with indication of screening for primary aldosteronism, it is recommended to continue most hypertensive medications other than the MRAs prior to initial screening to minimize barriers to or delays to the screening. So that's one of the changes. The other one is in adults with resistant hypertension, screening for primary hyperaldosteronism is recommended regardless of whether hypokalemia is present to increase the rate of detection, diagnosis, and a specific targeted therapy. In adults with hypertension, another change without clinical CVD cardiovascular disease, but with diabetes or CKD, or at increased risk of 10 years CVD risks, based on the PREVENT calculator, initiation of the medications to lower blood pressure is recommended when average systolic blood pressure is above 130 and average diastolic is above 80 to reduce the risk of CVD events and total mortality. Another update is in adults with hypertension without clinical CVD and with estimated 10 years risk based on the PREVENT calculator. Initiation of the medications to lower blood pressure is recommended if average systolic blood pressure is above 130 over 80 after 3 to 6 months trial of lifestyle interventions. In one of the other changes, in adults with diabetes and hypertension, ACE or ARBs are recommended in the presence of CKD as identified by GFR less than 60 or albuminuria above 30 and should be considered when mild albuminuria is present to delay progression of the diabetic kidney disease. Also, in adults with hypertension, a goal of less than 130 systolic blood pressure is recommended to prevent mild cognitive impairment, and dementia. And lastly, individuals with hypertension who are planning a pregnancy or who are become pregnant should be counseled about their benefits of the low-dose aspirin to reduce the risk of preeclampsia and its sequelae. Again, this is an initial list of summaries of the changes in the new guidelines. Also, they very much emphasize the use of PREVENT calculator. I've also included the link over here for you to see. Make sure to comment on the video if you have questions on the link, and I'll be happy to provide you with the link for the PDF access of these guidelines. Hope you enjoyed this video. As always, stay safe and take your medications.